Welcome to the Sydney Startup Show. This is Callum Bir from AI Ventures. Together with me today, we have Rafic Habib from Clinic to Cloud. Rafic, welcome.
Thank you, Callum. Thanks for having me.
Rafic, it's been such a pleasure having you on the show with us. Wow, we haven't caught up in person since COVID, and it's been great to see you again. And wow, we've kind of known each other for a little while now, Rafic. And I'm super excited about where Clinic to Cloud is since the early days. Since we started talking about Clinic to Cloud, you as a founder, CEO of that. Tell us a bit more about Clinic to Cloud and a brief introduction to Clinic to Cloud.
Thanks, Callum. So Clinic to Cloud is a born-in-the-cloud practice and clinical management platform focused at the private medical clinic in Australia. Clinic to Cloud came to live essentially about 2015. We went to market with 2 clinicians back then, early days. Remember writing the first story about, how a clinician needs to log in with an email address and a password. That's quite exciting. Good old days of really young startups. We went to market with 2 clinicians. Fast forward today, I wouldn't call us a startup anymore. We're probably in the scale-up zone. We're growing very quickly. We have over 2,500 clinicians on the platform, servicing 3.5 million patients, transacting about $450 million through the platform. The company itself is in excess of 100 staff globally, and we're in a very exciting phase of growth. Yeah.
So I remember, Rafic, catching up with you sort of like the 2015, like your really, really early days, and I remember sort of us talking about lots of things. Since then you've probably pivoted a couple of times, but you've stayed the course. I think that's admirable. Tell us about your journey and what was it like sort of in your early days, 2015, 16, 17, and how is it different since, I guess, when we started talking about Clinic to Cloud?
The learning. I often reflect on the term, if I knew then what I know now, right? I remember starting Clinic to Cloud on the back of a very long IT and healthcare career. And it's one of those businesses that has a higher mission. It's our mission is to connect millions of patients and doctors globally in order to help improve healthcare outcomes. So that resonates with a lot of people. Everyone is a patient, right? Even doctors and nurses are patients themselves as well. And we wanted to create connectivity between patients and doctors and deliver better healthcare outcomes by supporting the frontline people. But starting in 2015, I was thinking software. I was thinking, how is the user going to use it? I was incredibly concerned with my source code. I used to think source code was one of the most important things in healthcare, right? In business, not in healthcare. One of the most important things in business. And I'd constantly download my source code, make copies, protect the password protected, take a copy home, put a copy at a friend's safe. I was so obsessed with it. And then you fast forward 5 years and you're looking back and you think the source code is only a small portion of what you need to make a good company. The biggest portion is people. You need amazing people. You need good people that you can work with and rely on. You trust them and they trust you. So the journey is very interesting. You learn so much along the way, and it's exciting.
What was the problem statement that you're trying to solve when you first started Clinic to Cloud, and and what does it do today? Is it same? Is it different?
Interestingly enough, it's the same. We've pivoted operationally. We've pivoted in terms of areas of focus, because we were trying to solve too many problems at once, or for too many areas potentially. So we had to focus that energy. But the underlying pillars as to what we do and what we deliver for healthcare are the same. So and that's 3 pillars. The first pillar is information at the point of care, ensuring that frontline people, whether you're a receptionist at a practice, whether you are the doctor who's performing surgery, doesn't matter who it is, you need information in order to provide better outcomes. And one of our jobs is to make sure that information is available real time to these frontline people whenever they need it. That's the first pillar. The second pillar is the patient engagement pillar. We've always thought about the patient as being the hero of the story. We're all patients. We've all been a patient. We all know patients. And the way I think about it is no patient chooses to get sick, right? Don't get up in the morning and say, I feel like getting sick today, right? You don't. But when you get sick, you want the best possible care. And you want to be involved in that journey of care. And for a long time, the patient wasn't involved. The patient was part of the process, was transacted across the sector, but wasn't actually involved in their care journey. So in 2015, one of the things that we did off the cuff, we launched this product that practices and doctors can use, but we also launched a patient portal, minimal level. That's because in 2015, I knew that in 2020 there was a pandemic coming. No, I didn't. I'm joking. But fast forward to 2020, and that patient portal is what everyone wants. They need the patient portal so they can provide telehealth. They can create a contactless environment. You don't want hundreds of patients roaming your practice during a pandemic. So the more they can do before they show up, the less contact they have at reception desk, the less people are in the waiting room. So it's serving a purpose. So digital health got accelerated on the back of that. And then the third pillar, and a very important pillar, is interoperability. You'd think Australia is one of the best healthcare systems in the world, arguably. Right? We have amazing doctors, well-trained. We kind of proved that as well during the pandemic, the responses, the behaviours. So how does someone like us add value to one of the best healthcare systems in the world? And I believe part of the answer there is creating interoperability, connectivity across the sector. So not one entity or person is going to solve all the problems. But if we work better together, the way Microsoft and Apple did, right? When they started working better together, everyone was better off for it. So it's the same mentality needs to be applied to the healthcare sector and allow interoperability across the sector with respect to privacy and compliance and all that. I'm not saying, you throw data around. You've got to be really careful with all that. But the more interoperability we do, the better the experience of the patient is going to be, because you create a single episode of care, continuity of care across the sector, and the less stress there is on the care provider, on the healthcare professional in the industry, because they don't have to run around trying to get the lab to fax the results to them. Believe it or not, that's still the main medium of communication today in the sector. The fax is there and it's prominent. So interoperability, in my opinion, is one of the pillars that will add incredible value to this sector. And everything we do today still fits in one of those buckets. That hasn't changed. Sometimes we'll lose our course a little bit and we have to course correct.
So I mean, you mentioned Australia is a relatively advanced market. The adoption of technology with the healthcare sector, healthcare professionals is very, very high. I mean, yes, they use fax machines, but that's a legacy of the past. Sure. Vis-a-vis the adoption of technology. It's almost like it's a two parallel system world that runs in. It's two different parallel worlds that run simultaneously in most physicians' lives. I mean, obviously the adoption of technology in the consumer sector is very high, but in the healthcare sector, it's still relative to emerging markets where you and I have spent a lot of time traveling to. It's not necessarily as high. So what was the challenge at that time? Again, if you just recall where things were in 2015, 16 in early days of Clinic to Cloud, was it more about replacing existing technologies they were using at that point of time, or was it more about getting them on board from paper to your platforms?
It's predominantly replacing existing technology in Australia. You've got the private practice in Australia is quite mature, and it started in the GP world about 30 years ago, where the GPs were incentivized to digitize their healthcare records, and non-GP specialties all followed. So a lot of them use legacy applications, and you've got your early adopters, people who are passionate about technology. Doctors in general, for example, and love technology. They have the latest and greatest, iPhones, iPads, etc. So they love the adoption of technology. But the software needed to catch up and provide doctors with apps on their phones, so they've got visibility, they've got information when they need it on their smartphone. Because if you're on call or you're doing a ward round in a hospital, you need that information. You shouldn't have to rely on faxes or text or WhatsApp to get the information. So the issue early on was that you have these legacy on-premise applications, and as a result, practices and doctors, and regardless of size, our smallest is one doctor and an admin, and our largest is about 1,000 users. So they still had legacy servers and applications. And the issue with servers and applications, you have the server in-house, right? It kind of gives you that comfort that your data is in-house, it's under control, it's safe. So the market didn't quite understand the risks associated with having a server in a practice that is not managed in the right way. If you think about it, nobody knows better than you how much money Microsoft spent on Microsoft Azure, and the level of technology and security and advances that they built into the platform to ensure that the platform is safe, it's secure, there are backups, there's monitoring around the clock. But my server is here. My server is under my desk. I know where my data is. And now that was an education process that the industry had to discover. You can't force it. But so there was fear of the cloud. There was fear of not having control over your data. Is it safe if I put it in the cloud? But a lot of these conversations changed quickly in the past 24 months. So what was headwinds is now tailwind, right? So if you're not in the cloud, then you're doing your practice a disservice because you're putting your data at risk. And with the new privacy laws that came out in 2018 that said basically, if you don't protect patient data, you'll get yourself in hot water. There are serious fines associated, about $400,000 for an individual and $2.2 million for a corporation. So it made everyone think seriously about how to store that data, how to protect it, and how to use it.
So Clinic to Cloud, as the company name itself suggests, Rafic, I know, you're probably one of the, I don't know if early adopter is the right word. You're one of the first to go to market, to build natively, born in the cloud, to natively have your platforms in the cloud right from day one when the market was perhaps not even ready. And I know you and I kind of spent a lot of time talking about why cloud back in the early days. What is it like now? I know you said that, the adoption and some of the, headwinds have become tailwinds. What's it like now, talking about your company being on the cloud vis-a-vis others that have, obviously caught on, or some people are still catching up, but a lot of people have caught on. But what's the market landscape now?
Most of the industry, most doctors today, I think I was reading a survey at one point that said 70% of practices said they want to go cloud. So there's definitely a mindset shift around what cloud means to them and how it's an enabler. So the conversation has shifted in the right way, in the right direction. It's shifted away from, server versus cloud, and now the conversation is, what are the benefits of going cloud? What is the uplift for me? What does it mean for me as a business owner, as a clinician? One, the first question is going to be, the safety and around the data and the security of the data, and what happens if I want my data back. So as long as you can address those two questions, and which we do really well, because on the security and backup perspective, we leverage Microsoft Azure, and data ownership sits with, we are simply custodians of that data, so we never claim that it's our data. So once those two boxes are ticked, then the conversation pivots towards, you know, what does it mean to be cloud first, mobile first? It means your data is highly available, highly secure. It means you can access it off your smartphone if you're on call or doing ward rounds or after hours, or you need to go home, spend time with the family, then jump on and do some work. Better lifestyle. It means you can connect the patient in, so the patient, that you create patient engagement and transparency. It means if you're a doctor who's running a practice or an enterprise who's running multiple practices, you want patient engagement. You want patients to trust you. So how do you get that trust? You create engagement, you create transparency. That's how you win. That's how the airlines did it. That is how what Uber does. It's what Apple does. So you just allow that your customers to be involved, and it's working.
It's interesting you said, something I hadn't thought about. I have not heard in a while now. You talked about cloud first, mobile first.
Yes.
Today, 2021, we take mobile first, mobile only for granted. But I remember, you talk about that, mobile first, cloud first, or cloud first, mobile first. You're born in the cloud, so it wasn't even first, it was only, right?
It was only, correct.
But what's it like now? 2021, tell me one doctor that's not using mobile phone, not just mobile phone, but even tablet, right, of some sort. What's that seem like now?
It's still common. We've only got like around 10% of the market. So the majority are still server-based, desktop-based applications, and I guess a lot of them don't know what they don't know, right? If they don't know that these options exist and that they can trust them, then they can't make a decision on it. So it's still, and the healthcare segment is still fragmented, right? If you think about it in national terms, like if you saw a doctor here, the MyHR is trying to solve that problem. So if you go see a doctor in New South Wales and then you're traveling through Victoria and you expect, that new doctor, he or she can download the record or access your file and treat you and create continuity of care for you. But it's not so simple, right? It's not quite there yet. So there's still a lot more work to do.
As a startup, I guess, I still kind of see this as a startup. It's a scale up, but if you think about startups in general, I think Uber would probably call themselves a startup still, right?
Yes.
And you think anything is a startup under that 7 year plus, that 7 year sort of time frame. What was your journey like as a company? What were the types of problems you were solving earlier on in your startup, vis-a-vis the types of problems you're trying to solve now? Just walk us through the background. I know we even talked about product development was an issue. How did you spend your time in the first, I guess, leg of your journey in Clinic to Cloud, and how are you spending your time now?
In the early days, you're very product oriented. Any founder, I think, in my opinion, should be that way, product and customer oriented. When I say product, the product is there to serve a customer. It's not. If your product's not serving a customer, then what's the point, right? Can't monetize it. So if in the early days, and there's still a strong element of that in me, very obsessed with the product and the customer and healthcare in general. So that's where I spent potentially 80-90% of my time, speaking to developers, speaking to customers, and making sure what developers develop what the customer wants, right? And I often used to say, claim to be the translator between tech and healthcare. So you fast forward, and then if you want to scale a company, then one of the most important things you need to do is, apart from having funds, is surround yourself with the right people who share that passion, share the vision, and want to provide the customers the best experience possible.
And what about now? How do you spend your time these days?
A combination of people, continuing the mission and the vision statements around, you know, who we are and why we exist, and how we'll use technology to empower the sector, and bringing people on the journey. I believe in frontline leadership. I wouldn't ask anyone on the team to do something I wouldn't do myself. So I spend a lot of the time with my people, and the rest of the time is outwards focusing, industry, colleges, government, etc.
What are some of the key things that, what would you say would be some of your top things you would not do in hindsight?
What would I not do?
Like, I mean, you know, you think about, you know, we did a lot of things, right?
Yes.
I mean, I look back as well and I kind of think, oh my God, that may not have been the best move, right? On hindsight, it's obviously easy to see. What would you say would be some of the things that you ended up doing, some big decisions, really, really big macro decision that didn't work out, and you go, wow, I wish I hadn't done that because that was a waste of time, or, you know, wasn't the right move, or maybe it was the right move but not the right time?
Possibly. So one of the things we do is we have an amazing platform that services non-GP specialists, and I have ambitions to do more, expand vertically, horizontally, new markets, etc. Sometimes you've got to balance ambitions versus actual outcomes. Sometimes you just have to stay focused on the knitting for a little bit longer before you can jump into new markets or new segments. I don't regret trying. I think I'm a bit of a glass half full kind of person. So I put a lot of things down to learning, and you learn from trying things, right? And often when you think you've made a mistake on something, I've found that the true outcomes are not in that moment. In that moment, you're just stuck in the rut and you're trying to fix a problem, or you're trying to come out of a problem. And then a few months down the track, sometimes a year down the track, you look back and you say, oh, that wasn't actually as bad as I thought. That was good learnings, and it was meant to happen that way. And if it didn't kill you, then you're still around, then keep
And
going.
what would you say some of those things are? I mean, tell us some stories. I know we've got plenty, but what can you tell on air?
I know that's a bit of a tricky one. Why don't we park this one? I'll come up with something a bit later down the track. I'll think of it while we're speaking.
Awesome. I mean, I think I think one of the things that most founders that I talk to all the time, they love a bit of war story. They love a bit of story that they can learn from. We love the idea of learning from each other, learnings so that others don't make the same mistake. And that's really what it is, I think. It's easy, I think, to talk about what some of the successes are. So before we we'll probably come back to some of the learnings, some of the stories.
Actually, I just thought of one that you and I were involved in. Sometimes, especially in the startup world, you're bootstrapping a business, cash is tight, and you get this amazing idea around, I could make a few moves, go somewhere else and save a bucket of money. Sometimes it's false economy. If something's working, just focus on what's working. Don't get distracted. And this story, like once I decided to jump development houses, and I moved from one part of the world to another, and $100,000 later, didn't get the outcome I wanted, and I had to pivot back. So where in that particular instance, instead of moving, trying to save money, I could have thought about being more efficient here and saving money where I am with the same people. And always treat your vendors like you do your staff. I always do. As you know, I'm very passionate about people in general. I love people. So I never treat a vendor like, I pay you, you do what I want. That's not my mentality. I see them as partners. I like working with them, and the more you engage with your vendors, especially if anyone is trying to do a startup with offshore developers, bring them on the wide journey. If you don't do that, it's never going to work. So I'm very passionate about that. So I will make myself available to developers and say, you're working on this application. Do you know why? Do you want to know the why? Because what you're doing is very important. What you're doing, it might look small to you, it might look like a bit of code, but in real terms, it's going to impact a patient on the other side of the world. So that's why your work is meaningful.
Now, offshoring is not necessarily a bad thing.
No.
The question I have there is, what would be, and you've probably had a bit of time to think through that, what would you say was things that might have been telltale signs not to do, or things that, that went wrong, if you will? What's the learning side of that? Not so much you switch, but in addition to that, what would be the essence of, what do you say, were some of the things that went not the way you wanted with your offshore team?
When you're offshoring, you got to understand who you're dealing with, right? If you're offshoring out of Sri Lanka, if you're offshoring out of India, if you're offshoring out of Vietnam, no, they're not the same country. They're not the same people. There are different nuances, different behaviors. You got to understand those behaviors. You got to understand how to communicate things the right way. And you got to be really clear with your instructions, with your stories, down to the story level. Are your BAs or UXs defining the stories in a way that is consumable by that offshore center? Get really clear. We've gone to other levels where we have, pictures and of people who they're dealing with, what they like, what their hobbies are, what their specialties like, in order to connect people in the right way, to try and add value to that human connection. It's always humans, right? Just because they're offshore doesn't mean they're not human anymore. They're still humans. So, but sometimes if you're stuck in the rut on this side, maybe not you yourself as a founder, but others around you might, you're customer facing here. So you've got a customer screaming at you about a feature not working. You're still dealing with another human on the other side of the world that doesn't understand that. You need to translate that in the right way.
So on that offshoring and getting your product development out, how much do you now do onshore vis-a-vis offshore?
We're probably 50-50. Actually, no, probably 30 here, 70 there.
And what are the things you do onshore, on-site, in office, as opposed to, what gets sort of done remotely?
We do a lot of the discovery, a lot of the planning here, a lot of the customer-facing user experience, feature function designing and planning, the workflows. So all that gets done here, and then the rest gets outsourced to whatever teams we want to use.
So that's a big lesson, I guess, in itself, in terms of how to optimize nearshoring on-site, what you do locally, what you keep to yourself, what you keep to very close people around you, vis-a-vis what you kind of are able to share with others internationally, etc. in your development team, I guess.
Absolutely, because if your customer base is here, you need people who understand this customer. And your offshore people don't have that sort of exposure. So you need to make sure the exposure is here. The people here can speak to those customers directly, do the discovery, do the learning, whether it's new features, whether it's enhancements, whether it's bug fixing. You need the people here to understand that, and then translate it in a consumable way to developers wherever they are.
And today, Rafic, you've got 100 people.
Yes.
Or thereabouts. That's come a long way.
Yes,
I remember going to your office in Pitt Street at a point, and I don't know how do you fit the 100 people there now, since you've probably grown.
They're not all in the Pitt Street. No, well, now we have the whole floor in Pitt Street. We also have an office in Brisbane, office in Melbourne as well, and a few remote people in other areas.
what does your team composition look like? And this is probably helpful for many founders out there, because some of them are probably at very early stage at the moment, thinking, at this point, wow, 100 people, I'm struggling to hire or get enough capital to get the first 5 going, right?
Yes.
Or maybe the first 10 going, or if you have 10, thinking, oh my God, where is that next 2 going to come from, right? Because each
We started with 1, right? You're looking at him. And then hired 1 BA and 2 developers.
Yeah. And you get to 100, and that requires,
Yeah,
not just cash.
Yeah.
It's also, it's not just cash. It's also a lot of manpower. It's a lot of organizational structure for that to function in a certain way.
Yes.
How did you, how do you get to this point, and what are some of the key lessons learned? What worked? What hasn't worked?
It's a really good question, actually. I was thinking about that. So, startups are not for everyone, right? And founders are typically positive, high energy, happy ease people. Like, you look at a glass, it's half full all the time. There's 3 drops in there, it's still half full. I can make this work. You've got to be honest with yourself and with your people when you're hiring. Got to be really transparent, and I didn't always understand that. I made a lot of mistakes, and you don't realize that startups are hard, and somebody's coming from a large corporate, and they've done the job of technical BA or UX or selling for a large corporate, where you get a 100-page manual. Read this and you'll be one of our best BDMs if you execute exactly this, right? Then you come into a startup and you say, okay, here's a product, good luck, right? So you've got to be transparent on the way in. And one important question you need to ask yourself, and again, founders, I think everything revolves around them, and you got to ask yourself the question when you're talking to someone. One, you be really transparent about what a startup life looks like, and how you lack processes, and these things come along as you grow. But then you need to ask yourself one very important question. I like this person in the interview. I like Callum. But can Callum work with Susie over there? Because Susie hasn't met Callum yet. And is she going to clash with him? Are they going to have an issue? Because startup, it's a startup. Today you're designing databases, and in the afternoon you're washing dishes. That's startup life, right? Because we can't afford a cleaner in the early days. So you've just got to be real with yourself and with your people.
And what would be some of the key lessons learned? I mean, this is not your first rodeo. I mean, you've run businesses before, Rafic.
Never this big though. This is
Right.
the biggest I've gotten. Yep. Made more money before, but that's that's a different discussion.
But I think that's a good segue into getting into how did you get into this startup? I mean, that's a great segue. I mean, you've got such a good story, and I mean, we've talked about this before, but Rafic, what about for the audience? Is this something you're happy to talk about? How did you get into the startup?
So I might rewind a little bit. Over 23 years ago, I was setting up a managed services company, IT, building, selling computers, servers, etc., consulting for anyone who needed it. Didn't matter at the time. And then my dad at one point had a problem with his eyes, so I took him to an ophthalmologist, a specialist ophthalmologist. And while we were seeing ophthalmologists, that doctor had a problem with his computer. And my dad's eye condition was quite serious. So I said, you look after my dad, I'll look after your computer, as a joke, right? He said, are you in IT? I said, yeah, I am. He said, okay, I'll take you up on that, but not now. I'll give you a call. That was my first ever healthcare customer. That gentleman is now my business partner in Clean to Cloud, right? So that's how the journey started. After meeting Andrew at the time, I realized that there was a gap in healthcare. So I realized that doctors needed computers. They were starting to adopt computers at the time, but there wasn't anyone in the industry who's focused on servicing these doctors. So I started that business, and from the ground up, bootstrap. But back then, in Australia, like raising money and all that wasn't a thing yet. So you just bootstrapped it. You robbed Peter to pay Paul, and you keep building. And that business ended up being quite a large business, not as big as this, about 20 people, reasonably successful. And then about 10 years into it, I realized there was another issue in the non-GP specialties where they didn't have the tools to manage the way they manage their letters. So that was my first SaaS business, maybe about 13 years ago. So with a partner at the time, we built this product that integrated into legacy applications, doctor app, the doctor dictated into it. In the back end, there's a voice to text engine that translated the doctor's dictation into a letter that went out to the referring GP at the time. And then in 2014, the writing was on the wall. Cloud was incoming, fast and hard. AWS was doing well. Microsoft Azure was looking to launch data centers here, and there was the hype around cloud technology and how the SaaS world was going to come in. But there wasn't anything in healthcare that focused on my particular segment. I'm sure there were others, but this segment it wasn't addressed. So I ended up selling the managed services business and focused my energy on building a cloud solution. I partnered with Andrew, and then a little bit later another doctor joined, Joe, so kind of the founders, and we just put our head down and started building.
Are you kind of glad that you sort of sold that managed services business? And do you ever look back and you think, gosh, I wonder what happened to that?
I'm glad that I did. You see it today with companies who have legacy applications and want to go cloud, and it's a struggle to shift, right? To get out of this world into this world and cannibalize your own market. Not easy to do, right? So could I have been more money oriented, made more money? Yeah, I could have, but it wasn't the driving factor. The driving factor was there's a big gap in healthcare around mobility, patient engagement, interoperability. And if I stay here and try and maximize dollars here, then I'm never going to get the opportunity to do this here. So yeah, made the call at the time. No regrets.
What was your main consideration in, what was your sort of, couple of key criterias, that you had at that point of time that kind of made you confident, other than the glass is half full, that I can do this and I have the necessary ingredients to pull this off, or I can get out there and whether it's capital, whatever those ingredients are, what were some of the main key criteria that you kind of had to yourself that gave you that confidence to, make those bold moves, i.e. sell off your business, start up Clean Cloud?
I could see the gap in the market, and it's a market that I know well. I understand my customer reasonably well. I'm very passionate about it, and if there's anything I don't understand, I want to learn it. I think they were the key drivers. I could see what they were doing. I could see the inefficiencies. I could see how I could add value. You never know for sure that they're going to buy your product, right? Until they do. But I could see that by producing the right product, the right apps, the right connectivity, it was going to make a difference. It was going to add value. I love selling the product as well, but I have to believe in it to sell it. That's the way my head works, my brain works. If I believe in something, I love promoting it and selling it. So I really, really believe that this was going to make a positive impact on our doctors, on the patients, on the healthcare industry. That's really what drives me.
And in terms of, one of the biggest ingredients most people kind of need beyond belief, and the desire to do this and be mentally prepared to do this as well, is capital. Because without a certain amount of capital backing, either from external parties or bootstrapping yourself, um, and especially in healthcare, it does require a lot more,
Yes.
and takes longer.
Yes.
In general, at least that's what I've seen most of the time.
Yes.
How did you go about doing that?
I was fortunate enough because I could start with me and Andrew and other founders, and we were able to bootstrap it for a fairly long time until we raised money last year. And because we were able to generate, we went beyond just a concept. We commercialized the product. Customers were buying it. They were paying for it. There was revenue. So once you do that, and you got to be focused on that. So it's one thing to build product, another thing to commercialize and get out the market, and you need the right people around you to help you do that. So once you do that, then go out and pitch to investors, and that's not easy. You got to go out and do a pitch, and then you repeat, you get rejected, and you repeat, and you just keep going. And you've got to do, in my learnings there's two things you got to know well. You got to know your customer and your product, and you got to know your market, and you got to understand the financials as well and what it means to those investors, and not get caught up on valuation and thinking that you're worth a lot more than what you think you're worth. So these are some of the tips I could give.
Are you able to share, what you've raised or valuations or any of that? What are you able to share in terms of your recent raise?
So probably not the valuation bit because I don't get caught up on that. But in terms of the raise, mid last year we were fortunate enough to do a pitch, and we were able to raise $13 million.
Yeah. That's a decent size, but that said, in healthcare, that's not necessarily ever enough.
The raise is never enough. You've got to be disciplined as well with the deploying the money and how you deploy it, where you focus, the percentages, revenue, like business development, marketing versus actual software development. So yeah, you have to be disciplined, but you need the right people around you. So I'm quite lucky. I've got a lot of good people around me who advise me and keep me on the rails.
And how has the raise of a reasonable sum has changed, if at all, how you think about running your business?
Very good question as well. It has, because like I said, founders, we're driven by passion and grit, right? We want to achieve something, and we'll just keep going to try and make it happen. And as I said earlier, you can have all the passion, all the grit in the world, all the energy in the world. You can't do it all yourself. You just cannot do it all yourself. So you need good people around you, the right people around you to help you get there. And when you have the capital, what it allows you to do is attract the right people, and they bring different skills and different disciplines, different approach to executing, to managing, to help, to guide you, to coach you. And that's worked well because it helps the whole company mature. Helps everyone. So you start with your values, and you just deliver messages, and your team kind of support those messages, and everyone creates alignment, and you have the right leaders in place. Yeah.
What do you consider yourself? I mean, you talked about lead by example and being the frontline leader, etc. Now you're running a 100-people team. What would you say has been your leadership style when you were sort of starting with the 1 or 2 to 10 people vis-a-vis where you are now?
The biggest difference is when you say 1 or 2 people, the communication is easy. You and me are sitting here, we're half a meter apart. It's easy. We can have a conversation, we can have a disagreement. can have a coffee, we can have a beer. It's all good. You have 100 people. You don't want to leave the message to chance. You've got to get clearer with your messaging. You've got to rely on your managers. You deliver a message. You be consistent across the board, and then you repeat. And then you trust those managers to continue that message, to propagate that message across the organization. And you just don't change your message. As I'm a classic founder, I can change my message twice in a day. And I've had to learn to stop doing that. If you have a clear message, that's your message. Don't change your message, and just repeat it and repeat it and repeat it and stay the course.
What do you do when you do want to change?
Talk to your leaders. Talk to your leaders. Change by consensus. Talk to them. Get their advice, and you'll get sobering messages and advice. They'll keep it real for you.
Awesome. I'm going to now hand over to our executive production team and see what questions are coming in from the channels.
So our first question is supported with some logos as well, and which is, he says that the 74% of health executives say that organizations should invest in more of a predictive modeling for the year 2021 due to the pandemic. So what do you see is the future for tech industry, tech companies who are trying to change the healthcare industry for the better?
So the first message was they need to invest in what? Sorry.
They're trying to invest. So he says they should invest more in predictive modeling.
In predictive modeling,
Yeah.
I don't disagree with that. I think that person is correct, but the trouble is at the moment there's a lot of data sitting on desktops and servers all over the country. There's no consolidation. There's lack of standards around it. So there's still a lot of ground level work that needs to happen to get us there. And then yes, by all means, this needs to happen. And I know a lot of large companies have been trying to do it, but you need the data, you need the discipline around it, you need to build it all up, and then start working with it.
And one more is, how do you think we could measure and monetize the risk factors which are associated with cloud computing when it comes to the healthcare industry?
The risk factors?
Yeah. So he seems to have tried it implementing in a banking industry, but yeah, when you change that to healthcare industry, definitely each industry is different. So he's trying to implement that into the healthcare sector, where he wants to know the individual risk and weightages, which when he's trying to implement that in the healthcare.
I believe if I understood the question correctly, I believe the question is around how can you calculate risk associated with an individual? Like, if I treat this person with X, what are the risks of a certain outcome? If that's the question, then again, I think there's a lot to be done in that space in terms of machine learning, AI being able to help us calculate those risks. And typically today, the risks are calculated based on historical data, which professional indemnity insurance companies kind of build up. O&Gs, for example, very high risk. So that's based on historical data. There isn't anything that's predicting that risk that I'm aware of, but there should be. I agree.
But it's interesting, just to kind of follow on from that question. And I recall you telling me this is a couple of years ago now, or probably maybe even longer.
Maybe more.
That there was a particular point in time where the insurances companies were charging higher premiums, for companies that were on the cloud, using technologies in the cloud. And now I think the situation has turned around, where the insurance premiums for not being in the cloud are higher. Is that you telling me that, Rafic?
There was, I'm aware of higher risk insurance around the specialty per doctor. And then at one point, yes, in 2016 actually, there was introduction of cybersecurity insurance because everyone was concerned with cloud. But I haven't seen that it's turned, but I'm not surprised because most of the breaches, I don't think there's been any cloud breaches, but there's been lots of on-premise breaches. Correct.
Yeah.
Yeah.
So my understanding, and again, I'm not an insurance expert, but my understanding, at least in Australia for sure, is that once upon a time, this is kind of going back in our early days, when we were still talking a while ago now, right?
Yes.
Let's not talk about the years now. There was a massive issue around adoption of cloud computing in healthcare. There were regulatory barriers,
We
massive.
did that dance. I remember. There was a reaction from the government, the health minister, on the back of the breach that happened in NHS. I remember that dance. Microsoft were instrumental with that. So the Microsoft lawyers and lobbyists were involved in explaining to government that the breach that happened at the NHS was due to Windows XP machines, not due to the cloud. They were using unprotected legacy desktop applications. That was interesting.
And then when it comes to insurances, etc., I think there was a perception certainly that cloud was certainly more insecure. Again, I'm just talking about perception vis-a-vis the reality. And there was a particular point of time in the cave when, the kind of caveman era where I think there was a lack of understanding. There was higher risk premiums. Premiums were high for practices that used cloud solutions, for any purpose for that matter. And certainly at the time, there was a point in time where there were obvious risks. There were even risks of using technologies like WhatsApp, because I do remember, maybe not in private clinics, but certainly in
Still happens.
people are sharing data in WhatsApp.
Correct.
And taking photos and
Correct.
sharing it with other doctors and healthcare practitioners
Correct.
in unsecured, not even in secure platforms. I'm not even
Correct.
unencrypted platforms even. Now obviously things have changed quite a lot since, but
Not
nonetheless,
not really.
right. But nonetheless, it is still unsecure because of, certainly ownerships of WhatsApp is a concern and various other things. And you sort of think about that now of what we know that we didn't perhaps thought through 5-7 years ago. And certainly my understanding is the risk premiums have flipped, whereas if you are using secure platforms that are recognized, platforms that have been vetted by governments and have gotten various levels of compliances of various different governmental processes. Now there's a lot of governmental data on the cloud. There's a lot of healthcare data on the cloud. If anything, perhaps more secure because you've got regulatory processes
Correct.
that support that. But I think there is perhaps still nonetheless concerns, maybe both from the healthcare practitioner side, who may or may not be familiar with all of that. As you said, there's only about 10% penetration
From our perspective.
from your
correct,
perspective. But certainly not everything's on the cloud yet. And I think COVID's changing that. I mean, you think about COVID app. I mean, nobody wants to talk about that, right? But
they've done well.
they've done
The New South Wales
right.
services. Yeah. So you're right. There's still a little bit more education to be had in the space around what it means to be cloud. But you're right. There are still people, surgeons, a lot of specialists, not just surgeons, are like to take photos during op, post op, a mole, something they're dealing with, whatever they're dealing with, they like to take rightly so, right? We put something up on the whiteboard, we take a photo, not realizing that their iCloud or Android is automatically backing that up to another location, and then their family at home log in and they see those photos. You've breached privacy. Are you reporting that? Because it's mandatory reporting. So that happens because there's lack of understanding of WhatsApp, as you say. We've all experienced that. We talk about recording equipment. I guarantee you, when I open my Instagram this afternoon, there's gonna be an ad about what mixer to buy and what camera to buy. right?
It's already there.
It's already there. Correct. So, yeah, so there's the space is interesting, and providing doctors and frontline people the right tools. The tools are designed to protect them from all that.
So my last question would be, where do you see Clinic to Cloud by end of this year and over the next 3 years?
By the end of this year, we'll increase our position within the space. We'll take more market share. In the next 3 years, we will grow significantly in the Australian market. We'll get to 30%. And we will look at new markets. So as you know, I've always had ambitions to have an office in Singapore and one in the UK as well. So they're definitely on my radar.
Awesome. With that, we're at the top of the hour. Thank you so much, Rafic. It's been such a pleasure having you on show with us.
Likewise,
Thank you very
Callum.
much. Over and out.
Thank you.